Hello folks, I am Dr.Sophia Pillai. I am a pediatric pulmonologist, a specialist who takes care of children with lung disorders and also yoga and pranayama practitioner and teacher. Today we are going to talk about breathing exercises. What are breathing exercises? So to understand this better, do you know that an average person takes around 20,000 breaths a day? This we do without any conscious involvement, and it happens so effortlessly. So breathing exercises means that we are going to bring our awareness to the breathing, and this can be done by subtle postural adjustments and also changing our breathing pattern. So why is this important? Is this something new or fancy? Again, if you look at a regular day, we all do sigh breathing. Sigh breathing is basically an exaggerated normal breathing rhythm of us. So what sigh breathing does is it basically restores some of the lung capacity that has been changed or lost during our normal regular day because of poor posture, because we are slouching, or the breath is also influenced by emotions. If you're happy, the breathing rhythm is different. If I am upset, the rhythm is different. So the sigh breathing tends to normalize this throughout the day. So we are going to use this breathing exercises which basically expands on the sigh breathing principle. So there are two ways of doing it. One is with an equipment called a breath exerciser. So you might have seen something like this. So this is a plastic canister with a piston, and the other version is where you have multicolored balls. All we are going to do is, with the breathing, we are going to push the piston up or the balls up and then make it float. So that also helps improve our lung capacity and also changes the breathing rhythm. So it also has a plastic tubing like this with a valve attached to one end. So the other side actually plugs into the breathing canister, so the breathing exerciser. So for this, I want you to find a comfortable place to sit on, a quiet place, sit on a chair. And this should be at your eye level. So you can place it on a table if you find that is more comfortable. So the next what we are going to do is we are going to sit on a chair with our spine erect. As I mentioned, anytime you want to change your lung capacity or your breathing capacity, the first is to have a good posture. When I sit straight, the chest cavity immediately opens up nicely. So the next, whatever breathing pattern I change becomes much more efficient. So I'm going to demonstrate this once, and then we will go back to it again and then talk about it a little bit more. So for this, take a breath out. So I'm going to exhale. Then I'm going to place my mouth around this valve. Make sure the lips completely close the valve. So with this, I'm going to take a breath in. So when I take a breath in, what I am monitoring is whether I am bringing this piston up or making the balls float high in the on top. Let's do this. And then I exhale. I'm going to do one more time. What you can do is when you're actually taking a breath in, you can also keep it suspended. That means holding the breath at the end of a deep breathing in. And breathe out. So this is one rep. You can do 5 to 10 reps, which is one cycle. So you can do 5 to 10 reps every hour or as tolerated. So this actually, if you look at this, what it does is when I take a deep breath in, I'm trying to open up the chest cavity, and I'm also making sure that the diaphragm, which is the most important, the powerful muscle of breathing, actually comes down, again opening up the chest. This does two things. One, it helps open up all the lung sacs which have been kind of, like closed or shriveled because of injury, inflammation, or infection. The moment the lung sacs open up, it's filled with air, then gas movement or oxygen movement becomes much more efficient. Your saturation becomes better. Once I have good air movement, the sense of well-being improves. The third is I can also improve my muscle strength over time, especially after surgery or if I have been bedbound for a long period of time because of an illness. My chest wall muscles can become weak with time. So this also helps retrain those muscles and also build strength in those muscles. So this is with the breath exerciser equipment. So what if I don't have a breath exercises? You can simply do the same technique at home without any equipment. So again, choose to sit on a chair or on a bed with like a head elevated to 30 degrees. So here what I want you to do is, instead of like using the having a visual reinforcement, we are going to use our hands to see whether I am actually opening up my chest really well. So for this, what I'm going to do is I'm going to keep my hands under the chest bone. So if you look at it, if I'm in a relaxed position, it looks like like the hand looks like a dome. So just go a little bit further. So the hand looks like a dome. When I take a breath in, what I'm trying to do is I'm going to increase the size of this chest cavity both in this direction and sideways. So this is resting, and then when I take a breath in, so if you notice, the chest cavity actually grows sideways. So that means the capacity has increased. The other way of doing it is you can also have your palm on the stomach and the chest to see which increases or which becomes much more prominent with the breathing. So with this, take a breath in. And you can see with the breath in, my left palm or the palm over my stomach actually comes out. So when that happens, that means my diaphragm had been fully pushed down and my chest capacity increases. So I want you to try this at home and see how you feel. The things to remember when you're doing either with the equipment or the exercise without the equipment is sometimes when we take a breath longer, you might feel lightheaded. If that's the case, that means you're doing faster. So pause for a few breaths and then resume if you can. Or if you simply cannot do it, just do 2 or 3 reps every hour and then slowly build it. The second is you can also have cough. Why do I cough? So that means the lung sacs are now open and it's trying to get rid of the secretions from the lungs. Cough is a good symptom. That means my lung is doing its job to get the secretions out. So you can actually pause your breathing exercise when you feel like coughing, cough it out, and then also after the at the end of the breathing exercise, try and cough it out. So that will help keep all your lung sacs nice and open. So we talked about breathing exercise, why it is important, why we need to do it, the benefits of it. The benefits being your lung sacs become open, it gets rid of secretions, so there is less inflammation, less infection, a sense of well-being, and also helps improve your posture and your breathing. I hope you have fun doing this, and I will see you all later. Thank you.